Good afternoon, ladies and gentlemen, Trinity County. Thank you for joining us for our second news and media press conference regarding COVID-19. My name is Liz Hamilton. I'm the interim OES and Health and Human Services Director. And similar to last week, although I do apologize for the media feed last week, that's been corrected. We thank you for your patience with that. Similar to last week, we will hear from our Public Health Nurse Director, Marcy Ketzel, and then Christy Anderson, our Environmental Health Director, Ed Presley, our Office of Emergency Services, and our Sheriff, Tim Saxon, and our County Administrative Officer, Richard Coons. Dr. Richard Coons will be helping to moderate questions from the media that will be emailed in, and then have closing remarks. So thank you, and we hope that we answer all your questions.
Good afternoon, Marcy Jo Kutzel, Public Health Nursing Director, Trinity County. Thank you. First, we would like to update all of you on the Trinity County testing data for the COVID-19 and how testing will evolve in the days to come, as well as update you on what we are learning about the behavior of the virus and the strategies to continue to prevent the spread in Trinity County. The number of tests conducted on Trinity County residents as of 9:30 this morning were 53 total, with 50 negative and 3 pending. To clarify testing in Trinity County, I think there's been some confusion that I want to clarify, and I apologize because I think I'm responsible for some of that confusion. The diagnostic testing for coronavirus involves really 2 steps. So the first is to collect the specimen, and that's done through our healthcare system. And then the second is to perform the qualitative test on it to determine whether it's positive or negative. In Trinity County, our healthcare providers are collecting the specimens. We then send them to our hospital lab, and they then send them off, or we carry them, some of them, down to Shasta Public Health, or they get sent to a commercial lab. The specimens we send to Shasta Public Health are what's called Tier 1. So those are kind of the most important to get the results back quickly, because we get those results back much faster from our public health labs. That's true of most public health labs in the state of California. The commercial labs take a little bit longer. So I've received some questions recently from the press, noting that we had a higher rate of testing done in early March compared to other northern counties. So the testing data is per 1,000 individuals, and we had a rate of 3.1 as of March 31st. And here's what I can tell you about that. We began putting strategies in place in early March. Our OES director, manager, and the MOOC met primarily to implement aggressive strategies with an understanding of what was to come. We wanted to ensure early that our healthcare systems had what they needed for when this became more expanded. And we knew that without that, there would be a significant loss of life. We also had sufficient numbers of specimen collection materials, and we're coordinating with Shasta Lab and commercial labs to get those results. It is important for us to understand that we want to expand our ability to test in Trinity County. The time to do that is now. Unfortunately, as this is a statewide and a worldwide and a national event, obtaining the needed resources can be challenging sometimes. With that said, we are working with our hospital lab to bring specimen testing to Trinity County in order to expand testing and significantly reduce the wait time for results. This is going to be really important moving forward. The barrier at this time to do that is obtaining the test kits. One of the things I want to touch on with you will be thanking you and reiterating the importance of the policies that we've put in place to prevent the spread of coronavirus in our county. We're hoping that those test kits will come available in the near future. And we're working with Shasta Lab and our lab to make that happen, as well as the companies that produce that material, those collection kits. Expanded testing in Trinity County is going to be vital moving forward as we learn more about the behavior of the virus and how it spreads. We now know that the possibility exists for pre-symptomatic transmission. Essentially, that is an infected person being able to spread it to others before they really know that they're sick. And that the virus may potentially be spread by the act of speaking rather than just coughing or sneezing. In light of this, the CDC will be putting out a statement on the use of face coverings, essentially wearing them when out in public. The health department would like to reiterate, however, that face coverings will prevent a person wearing the covering from spreading it. So it's a one-way barrier, out rather than in. That's really important to know as we understand the asymptomatic transmission of this, or pre-symptomatic, before people have symptoms and know they're ill. If they're out in public and they have, for essential services, if they have to go out, and sometimes they may not be able to keep 6 feet if they're not. I know sometimes that might happen. That barrier will then prevent any individual that may not have symptoms from spreading it to others. We still continue to have a shortage of face masks, so we're asking people not to request face masks in the public so that we can preserve those resources for our healthcare personnel that need them, as well as the N95 masks and other PPE that we're obtaining. We want to reiterate the importance of complying with the orders that our health officers put in place, and that we're asking you to please try your best to comply with these. We can't, I'm going to let Tim, our sheriff, speak to this, but to reiterate what he said last week, we're asking you to comply because of the impact it can have. As a community member in our county, you are really helping us to prevent significant loss of life, in that if we overwhelm our healthcare system in the context of a pandemic where other systems in the state of California are also overwhelmed, we need to do everything we can to try to prevent the spread. We talked about the curve, the epi curve, making it a little flatter so that we don't have broad spread. We know that one person that has coronavirus can spread it to others. It's exponentially, it's multiplying exponentially. For one case, you'll have 4 3 days later. So I wanted to show you something that really is a visual that emphasizes how important this is, and by what you've all done, contributed to this map. I know it's difficult to see, but we will put a link to this on our website. I am utilizing, this is from the San Francisco Chronicle. They have a very good COVID tracking. It's daily. It updates this map on a regular basis. And if you see here, Trinity County's right there. There's 6 counties in California that do not have a positive COVID case, and Trinity County is one of them. We are surrounded by counties that have broad community spread. We just were informed yesterday that now Del Norte and Tehama County have a case. And so this is really important, and I hope that in looking at this, you will understand how very thankful we are and grateful to you all for making the sacrifices that you're making to comply with the orders that have been put in place. Thank you so much. And I'm going to turn it over now to Krystalyn Anderson from our Environmental Health.
Thank you, Marcy. I would first like to start off by saying thank you for all the cooperation from the small businesses out there. I know this is a very hard time right now for you, and we've been working really hard to get you those updates as quick as we can and how things are changing and moving, and really emphasizing that the essential services and the essential businesses, and doing our best to limit travel through the county to those essential services and in the county to essential services. Again, you know, we provide our updates as soon as we get them, and we just really, really are amazed by the support of the community and how some businesses are really reaching out and helping other businesses, and it's been great to see. So I want to thank all of you out there that are cooperating and helping in this effort to prevent the spread of COVID-19. Thank you. I would now like to introduce Ed Presley, Office of Emergency Services.
Thanks, Christy. Like she said, I am the OES manager for the county. I just wanted to pass on a few updates that we have. The EOC is currently activated. We are supporting efforts from FEMA, from Cal OES, all the way down to our county. Public health does have the lead in this, and so we're here to support them. And the way we've been doing that is by making ourselves available to answer the phone, sending out press releases, answering questions, making sure everybody out there gets their questions answered or gets clarification on what they have. We have recently convened a multi-agency coordination group for information sharing and planning purposes around the county. Like Marcy said, you know, hopefully we can flatten the curve and hopefully this doesn't go on too much longer, but we have to prepare and we have to continue our planning efforts. There will be inconveniences in times like these because this is an unprecedented time. So we need everybody to keep safe, keep exercising the social distancing, taking care of one another. If you have any questions, you can go to trinitycounty.org or covid19.ca.gov. Everything that we do from here on out depends on you. You can really limit the spread if you do what we all need to be doing right now. And that's pretty much all the update I have. Tim, the sheriff is next.
Thanks, Ed. Tim Saxon, Trinity County Sheriff. Quick update, during this operational period, our administration office is still closed to the public. Most of our functions are continuing by phone, mail, fax, email. Our primary focus and mission during this period is the protection of life and property. Our dispatch center, every time we get a call for service, especially medical calls now, you'll notice that our dispatchers are asking questions with regard to health of persons inside the residence. This is because we're concerned about our first responders going into those particular residences, so we'll be asking questions. For example, does anybody inside that residence have a cough, a fever, nausea, anything like that? And it's again to help our first responders prepare adequately before they enter that residence. The Sheriff's Office continues to work to maintain a strong partnership with Office of Emergency Services and Public Health to guide the county through this serious emergency. One positive note I'd like to throw out there is that the Trinity County Food Bank recently reached out to the Sheriff's Office for help in getting prepared meals to our senior citizens who have been affected by the stay-at-home order. And to do our part to keep these vulnerable residents sheltered, safe at home, I've agreed to have our jail kitchen staff prepare meals using commodities supplied by the food bank to have our kitchen staff prepare those meals. And they will be delivered by the food bank to senior citizens in the county who have not been able to get out or who we don't want to get out into the community and be exposed. So I'm hoping that we're going to be able to start this program next week, and I'm really helpful or hopeful that this is going to be successful, and I'm very glad that we're able to supply this needed help for our community. In finishing up here, our objective is to seek voluntary compliance to the health orders through education, social pressure, and common sense. So please stay home and only go out if absolutely necessary. So I'd like to now introduce Dr. Richard Coons, County CAO.
Thank you, Tim. In closing, we haven't had any inquiries from the press, so we'll continue to put information out as it comes in, and we'll also, if we receive any information or questions from the press, we'll put that out. I just want to close with saying thank you to the community, thank you to the staff who's all working hard. From a county level, we're doing everything we can to keep everybody safe and informed, but the heavy lifting really falls upon the citizens of Trinity County. You're the ones that have to sacrifice, you're the ones that have to do the social distancing and make sure we continue to be the county that has no positive cases. So I really want to thank everybody for everything they've done. The hard work is paying off, the sacrifice is paying off. We ask you to stick in there with us, and we'll continue to keep you informed. So thank you very much for attending this press conference, and we'll go ahead and close it up.